All right. Well, thank you so much, everyone, for being here tonight. My name is Allie Thomas, and I am the Outreach and Development Assistant here at Sansum Diabetes Research Institute. And I've lived with type 1 diabetes for just over 11 years. So it's really an honor to be here tonight to be able to present our first ever virtual industry night in collaboration with Breakthrough Type 1 Diabetes. Just a couple of things before we get into tonight's presentation. Please go ahead and stay muted for the duration of the presentations, just so that everyone is able to hear. Speaking of here, my music just decided to start playing again. Um, Please also just be mindful that tonight's meeting is being recorded, so if you have to leave for any reason halfway through the call, or if you have a friend who couldn't make it tonight, or if you just want to watch it again after the fact, that will be available for you. I recommend that you have Zoom in speaker mode so that as we're going through the presentations, you'll be able to also see the speaker who's giving them. A huge shout out to all of our industry representatives who are here with us tonight. This is an awesome opportunity for us folks in the diabetes community to be able to learn all about the different management tools and just resources that are out there. So again, thank you so much for lending us your time and your knowledge this evening. One other promotion I want to say is clinical trials. That is the way that all of these diabetes resources are able to continue advancing. So if you are interested in participating in trials, there are a ton of different ways that you can do so. Real quickly in the chat, I'm going to be sharing a link to some of the resources that we have here at SDRI. So if you're interested in helping to participate to continue advancing diabetes technology, this is a great way to do so. Last and definitely not least, please remember that all of the information that we're covering in today's meeting is not medical advice. So if you have any questions about wanting to change your diabetes regime or anything like that, please go to your healthcare provider. Without further ado, I'm going to jump right into the presentation. So tonight's presentation is going to have two different parts. First is our industry presentations. We have lots of great people here to talk tonight. And then second is going to be our breakout room Q&A session via Zoom's breakout room feature. A little bit more about that when we get further into tonight's presentation. So without further ado, Marcella, would you like to add anything before we get started?
Hi, everyone. I just wanted to say hi. My name is Marcella. I'm the Community Engagement Manager for the Greater Los Angeles chapter of Breakthrough T1D. And we're so thankful to be here in partnership with SDRI and all of our industry partners. So thank you so much. And just a quick plug for an event that we are in partnership with SDRI. We have our Santa Barbara Summit coming up in May. So we will keep a lookout for a lot of information on that, but super excited to be here and thank you all so much. Thank you, Allie.
All right. Thank you, Marcella. First up, we have got Jennifer Chu from Abbott Diabetes Care Incorporated.
Hi, everyone. Thank you so much for being here today. It's incredibly powerful to be in a virtual room with people who get it, who understand the constant decision making, the unpredictability, and the resilience that comes with living with type 1 diabetes. Today, I want to talk about continuous glucose monitoring, also known as CGM. Specifically, I represent, specifically the system that I represent, the Freestyle Libre by Abbott. Um, Currently, there are four major CGM devices on the market. All of them aim to do the same thing: give us visibility, improve safety, increase time in range, and reduce mental burden. But how they do it and how they fit into your life, it can be very different. The Libre is designed with one key goal: make diabetes management easier without making life feel more medical. It's small, about a fourth the size of other CGMs, roughly and thick, roughly the thickness of two stacked pennies, discreet, worn on the back of the arm, easily hidden under clothing. Simple, the application takes a quick push and inserts in a millisecond, and safe and reliable with minute by minute readings, 5 times faster than other CGMs, and stays on 94% of the time. There's no extra button pushing, there's no separate transmitter, no calibration, no coding, no complex setup like a surgery, and it's just an easy apply and go. One of the biggest strengths that Abbott's technology has is its connectivity. Libre is partnered with every single major insulin pump company, all five. Why does that matter? Because strong partnerships only happen between pumps and CGM companies if the accuracy is trusted and signal reliability is strong. In fact, Libre sensors are 9 times less likely to lose connection during sleep. As you all know, one of the most vulnerable times for people living with diabetes, especially with hypoglycemia. So the Libre being here today, this isn't just a profession for me, it's personal. As you all know, I just admitted to the fact that I have type 1. I've had it for 37 years. I was 6 years old when I was diagnosed. And for years, I wore another continuous glucose monitoring system and truly loved it. I believed in the company. I believed calibration meant accuracy, brand loyalty meant reliability. And when the newest model came out, I was really excited about it, but every single sensor that I wore for 10 months had issues. I had signal loss, sensor errors, calibration failures, and sensors fell off. For 10 months, every single sensor failed on around day 7 or day 8. That was a big problem for me because I'm an avid exerciser. I do CrossFit 5 days a week. I do triathlons about 2 times a year. I recently competed in three, what's called a high rocks competition. Needless to say, my CGM working is really important to avoid those unnecessary highs and lows. But I did not switch companies. I was that loyal. I believed in it, and that's okay. Um, Loyalty is real in the type 1 diabetes community, and I get it. I get the importance of being married to your CGM device. And I understand when things go well or they're okay to continue wearing what you're wearing or going without a CGM. Um, but what I saw surprised me. I saw with CGM that my A1C got better. I had higher time in range and I had really great daily patterns. And then when I switched, they were actually, so I actually got the opportunity to try both side by side. I didn't want to switch. So I wore both of them because I had the opportunity to. And what I found was that I got the same A1C, same time in range, and same daily patterns. So Libre is, I don't know, how much time do I have, Allie? 1 minute left? Okay. Um, Libre continues to evolve with features designed to make diabetes management in real life better, like smartwatch integration, which is new, follow apps, pump connectivity, AI-driven food glucose insights, giving you confidence, reducing guesswork, and supporting proactive decisions. At the end of the day, no CGM is perfect. The right CGM is the one that fits into your life, reduces your burden, and supports your goals. And Libre was that shift for me. I'm going to leave a few things in the chat with just some links to patient resources. And if you have any questions, feel free to come into my breakout. Thank you for your time.
All right, Jen, thank you so, so much. Again, like she mentioned, if you have any questions for any of the representatives, we will have a breakout Q&A session at the end of the meeting. All right, I'm going to go ahead and share my screen. All right, can I get a thumbs up if people can see it all right? Perfect. This is just a little look at what the freestyle looks like on the arm. And next up, I would like to welcome Catherine Chen from Beta Bionics.
Hello, everybody. I hope you can hear me. My name is Catherine. I'm with Beta Bionics. I'm actually a dietitian and diabetes educator myself. And I originally was very intimidated by pumps. When I was working in clinic, I didn't really get too much hands-on experience with pumps just because I was always afraid of having to deal with settings and dealing with like how to go over carb counting into the programming into the settings for patients. So when I came to Beta Bionics, I was actually very excited that now there is an actual insulin device that takes away a lot of that complication and complexities of having to deal with a new diagnosis of diabetes and then having to learn all of the carb counting that goes along with it. Um, Ali, I do have my slides. Okay, great, thanks.
Mhm.
So this is a picture of what the iLet looks like. It is a very fully adaptive automated insulin delivery system. So what that means, on the next slide, Ali, please. So adaptive means that it's constantly changing with you. So traditionally, like if something happened, maybe you got sick, or maybe you had a different day going on, because there's no 2 days that are the same in diabetes. You would have to go into your settings or call your doctor, call your nurse, and try to see like, okay, how am I going to correct? Like, how do I adjust my insulin sensitivity factor, basal, all of that. With the iLet, that's what the Beta Bionics device is called. It will watch your blood sugar, and it's compatible actually with the Dexcom G6, G7, and the Libre 3 Plus that Jennifer was just mentioning. It's reading your blood sugars every 5 minutes, and it will adjust with you what your basal needs to be, what your correction needs to be. So you're not having to be hyper vigilant with managing your blood sugars on top of living your life. Um, so in that sense, it controls 100% of your insulin needs for you so that you don't have to do it. It's the closest to a fully closed loop system, which means that you don't have to be, interacting with it, so much. Um, and on the next slide, you can go over. For those who have been on the islets coming from other systems or from injections, we do see a lot of improvements with less engagement required for having to manage your blood sugars and your insulin on your own. We see almost in kids almost a 2% improvement in their A1C, in adults 1.6%. And we're comparing A1C to GMI, which sometimes actually overestimates by zero point 0.4. So you can see actually that the improvement can actually be more than what's stated here. But that's just to give you an idea. This is based on 2 years of real world data. So this is post-market. And then on the next slide, this is what a day in the life will look like, or could look like, with the iLet. So there's no settings involved, which means that the moment you put it on, all you do is put in your weight and it will learn your body. So you don't have to, again, like program what your basal is. So for this person, this Tiffany here, she's just living her life. The iLet's figuring out like how much her basal needs to be every 5 minutes. And if it needs to change, it will change. And if it doesn't need to change, then it will learn and figure out her patterns as well. So when she eats, the most important thing is that the user is aware of what foods are carbs, but not to necessarily have to count every single gram. So in the device, she just needs to tell it whether she is having carbs, and if she is, whether it's a usual amount. Literally, the word will say usual, or more or less. And let's say, like, it's not completely accurate. It doesn't have to be perfect. But because it's watching the blood sugars every 5 minutes, it knows how much correction to make for you. So for the user, they don't have to constantly be looking at their blood sugars and then having to wait and see if they need to do anything, because the iLet's already taking care of it for them. And throughout the whole day, she's only interacting with it maybe at most like 3 times if she's eating 3 meals that have carbs. Otherwise, the rest of the time, she's just living her life. Um, and then, so how does all of this work together? On the next slide, there are 3 algorithms that are programmed into the device. So the basal and the correction work simultaneously together. And then the meal announcement is working a little bit separately, just because there does have the user tell it how much and when they're eating. And this is really great for anybody who wants to have great outcomes, but not necessarily to spend so much time even thinking about their diabetes. This is great for those who are just really tired of diabetes overall. And maybe carb counting is a challenge and a struggle, and every visit is always going over carb counting, maybe with a dietitian, and just it can get very, very complicated. So for those who are just really done with it and don't want to deal with it anymore, the iLet is a really great solution.
Right, we got
And
about 30
yeah.
seconds left.
Okay, great. Yeah, so I'll go to the next slide, which is what do people love most about their iLet? That they don't have to count their carbs. They don't have to constantly be adjusting their insulin or readjusting settings or being locked into those settings. And yeah, and thank you so much for your time.
All right. Again, if anyone has any questions for Catherine after the fact, we've got those breakout rooms for you. Thank you so much for your time. Next up, we have Laura Lee from Dexcom.
Hi, guys. Thank you for having me. Thank you, Ali and Marcella, for hosting this event. So excited to be here with you all. So I'm Laura. I'm with Dexcom. I'm also a clinician. I've been an ER nurse for 7 years, and I'm extremely passionate about educating my patients on the complications surrounding disease processes, especially diabetes. So today I'm here to talk to you guys about a resource specifically used for patients to manage their diabetes to help minimize the risk of those complications. So we have three products in our pipeline. We have Dexcom G7 10-day, we have Dexcom G7 15-day, and then we have Stelo. And I'll briefly cover all three of those, but let's talk about the first two and their differences. So we'll go ahead and go to the next slide. Perfect. As their name suggests, one lasts 10 days and the other lasts 15 days. So key features of the 10-day sensor include it has a 30-minute warm-up. It's approved for 2 and over, approved for type 1, type 2, and gestational diabetes. It is waterproof, and there is coverage across all payers, so Medi-Cal, Medicare, and PPOs. So everyone, if they are interested, it can be covered. So key features of the 15-day sensor. So this sensor has actually been only available since December, so it's relatively new. It is the most accurate sensor on the market, most accurate on day 1, most accurate on day 15, and then overall most accurate as well. It has the longest wear time of any sensor on the market at 15 and a half days. And it does have a 60-minute warm up due to FDA regulations. And it is only currently approved for 18 and over. It is approved for type 1, type 2, and gestational diabetes. It's also waterproof. And if a patient is covered for the 10-day sensor, they should also be covered for the 15-day sensor, except for Medi-Cal patients. We are currently pending approval to be added onto formulary for Medi-Cal, but nothing official yet. So if you want to go to the next slide. If a patient is not covered or qualified for the 10-day or the 15-day sensor, we do have an over-the-counter option. It's called Stelo. So no prescription is needed. When patients wear this, they do get personalized glucose insights and in-app learning. So basically, the sensor will learn the patient and make customized recommendations based on what they see. So, for example, if a patient is having breakfast, lunch, and dinner, and they're noticing that there is no exercise or medication management in between, it might make a recommendation and say, hey, maybe you should go for a 30-minute walk after you have your lunch. So those are going to be really good insights and recommendations for patients to help manage their diabetes, especially those with pre-diabetes or just want to be more health conscious. There are personalized settings with no alerts, no alarms. And that's kind of the glorious part for patients that don't necessarily have, that don't need to be on G7 10-day or 15-day. Sometimes the alerts and alarms can cause alarm fatigue, meaning if patients hear the alarms too often, especially if they're false alarms, they're not going to want to acknowledge their alarms. They're going to ignore them. So this option can be purchased on Stelo.com. It is FSA and HSA eligible, but otherwise it is $99 a month. There is an option to buy one sensor at $55. So for us, it is important for us to provide options for all patients across the board. So whether you have type 1, type 2, gestational diabetes, or pre-diabetes, or you just want to be a little bit more in tune with your health, we do have an option for everybody. And to echo Jen Chu, there is no perfect CGM. Technology is not perfect. Diabetes management is not perfect. But we all want to work together to try and make it as easy as possible to manage. So we want to make sure we can help patients improve the patient outcomes, but also improve their quality of life. And that's it for me.
All right. Thank you so much, Laura Lee. Next up, we have Colleen Black with Medtronic. The floor is yours.
Hi, everybody. Thanks so much for being on tonight. This is a great opportunity to learn more and to share. So, thank you so much. Again, my name is Colleen Black. I'm the local rep for the Santa Barbara territory with Medtronic. And you'll see on the slide, our name is actually very soon changing to MiniMed. So soon we'll be going by that name, which we used to have a long time ago, but we're switching back. So today I'm going to be discussing briefly how our 780G system, the pump system, works. You can go ahead to the next slide. So let's start with why we made this pump function the way it does. There are so many things that affect blood sugar besides just carbs and insulin on a daily basis for somebody living with diabetes. Other medications, hormones, lack of sleep, even a sunburn can lead to drastic changes in your day-to-day diabetes management. Go to the next slide. Our system was built with a little extra forgiveness for those exact reasons, to reduce the daily burden of diabetes management. Our pump was created to make life with diabetes easier. We recently did a study on our nighttime time in range, and we actually showed that majority, or on average, our patients during night were spending 91% time in range, which is fantastic. And with somebody living with diabetes, that means more sleep and less worry. As I'll talk about in a minute, our algorithm gives a lot of grace around mealtime. So forget your bolus, underestimate carbs, the pump's got your back. We do have flexible targets. 100, 110, or 120 will be your normal target. But we do have the temporary target you can set for 150 for when you're exercising to lessen the risk of going low. And then across the board, our worldwide data is showing that everybody on average is reaching 80% time in range. And this is people of all ages, of people, different experiences with technology, people who are great carb counters, people who aren't very great, people who are forgetting to bolus. This is across the board, 80% time in range. Go ahead to the next slide. So how does the 780G system work? The 780G takes 6 rolling days of data, of your data, and anticipates and adjusts at 3 different levels to adapt to changing insulin needs due to all of those factors that we talked about before. The gray roller coaster on this page represents your blood sugar, and the line across the middle is our lowest goal of 100. The first level of the algorithm is automatic basal adjustments, which are represented by the pink lines on the graph. So it's just showing your basal rate, or the little drips of insulin in the background going up or down based on your blood sugar. And once you're above your target and that basal rate is maxed out, then kick in the auto corrections. So every 5 minutes with the 780G insulin pump, you can get full auto corrections to bring you back down to that target as soon as possible. Go ahead to the next page. Our third level, and my favorite to discuss, is our meal detection technology. The pump, again, based on your personal data, 6 rolling days of data, and the rate of change in your blood sugar, so how quickly it is rising, can tell that you've eaten a meal and either you miscounted your carbs, which happens to all of us, or you missed a bolus, which again happens occasionally too. If you can see on the graph there, again, it's showing your blood sugar in the middle rising, you have your basal rate in the pink, and then the dark blue is the auto corrections, and the light blue on the top is that meal detection technology. It's giving you a stronger auto correction because it can tell that you've eaten a meal. So it's there to give you more grace around those time periods when you're busy and you miscounted your carbs or even forgot to bolus. Go ahead to the next slide. Okay, so what does the 780G system consist of? So it's our pump, which you can see on the page, which looks like this. We used to have the sensor. We still do offer it. This is the Guardian, but we just recently partnered with Abbott, and they created the Abbott Instinct for us, which is 15-day wear. Looks just like the 3 Plus, but it was made specifically to pair with the 780G system. And this is covered by all insurances except for Medi-Cal. We're still waiting for them to add it to formulary. And then we have the Simplera. This is another 7-day wear. It's a 1 press, easy to put on. It does accept calibrations. So you can use either of these based on what your preference is and what's easier for you. As well, we do offer a 7-day infusion set. So you can wear the infusion set, the tubing, for up to 6 or 7 days. We still offer, of course, the 2 to 3 day wear one, but people love not having to change sites as often. And with the Instinct sensor and the 7-day infusion set, it ends up only being about 6 site changes a month, which is really fantastic in reducing the burden, the amount of time that you're sitting there interacting with the pump. So in summary, the 780G system was designed to make managing the many aspects of diabetes easier. Definitely come talk to me. I know we have, the sensors are brand new to Medtronic. We've been using that Guardian for a while. So if anybody has any questions about the couple that we have right now and how the algorithm works, just come see me in the breakout room afterwards. But thank you guys so much for your time.
Thank you, Colleen. All right, next up, we've got Danielle and Katie with Omnipod.
Awesome. Thank you so much. So I'll mostly be presenting. I'm Danielle. I'm the territory manager for Omnipod. Katie is my wonderful clinical partner. This diabetes space means a lot to me. I was diagnosed with diabetes when I was 16 years old. It really stemmed my passion to become a dietitian. And now getting to help so many people with diabetes get their blood sugars into a place that helps them feel their best has been amazing. It really has been so fun. So let's go to the next screen. So I know we don't have a ton of time, but maybe if you can just do a reaction, how many people with diabetes have ever made a diabetes decision and then later on your blood sugar did something else? Like you went to bolus for a meal, thought you got it down, and it didn't happen. Yeah, that's what it's like to have diabetes. Yes, welcome. Every day can feel different. Diabetes is just constantly changing. And, for years, as people with diabetes, we've had to do a lot of that mental work on our own. And that's why I really want to share with you this technology that Omnipod has. So what is Omnipod? It's this little tubeless pump. It's an automated insulin delivery system. So no tubes, it's waterproof. There's no need for you to need to disconnect or remember to reconnect. It has an auto priming system, meaning that as you're putting the pump together, it's going to prime out those extra air bubbles on its own and insert the cannula on its own. So it's meant to be a simple process. It's adapting to your needs. So our Omnipod 5 algorithm is looking at your blood sugars every 5 minutes and making a decision in the background for you. If it sees that your blood sugars are trending up by an hour, it's going to give little bits of insulin in the background. Vice versa. If it sees that you're trending low, it's going to pause or give you a little bit less in the background. So what I like to call Omnipod 5 is like my little assistant, it doesn't talk back at me that much, but I feel like it really does help to make some of those decisions that I maybe necessarily wouldn't think to do because I can't see the future, but because it's looking at those trends, it really helps in that sense. It's very customizable. So we have 5 different targets and we are soon going to have a 6th one, which will be 100. But for right now, we have 110, 120, all the way up to 150 for your target blood glucose. And that's how our algorithm is going to work. It's going to try to keep you as close as possible to that 110 goal. We also have a custom foods option. So if you've found that maybe carb counting is daunting, I'm a dietitian and I've had type 1 for a long time. You could still ask me how to carb count a pizza and I would tell you it depends. So custom foods is a tool to help you simplify bolusing. You could enter small, medium, large. You could put up to 50 of your favorite foods. So again, it's another way to customize and make your management easier. We also have English and Spanish language options. So that's another great resource. Let's go to the next slide. All right. So the Omnipod 5 advantage, just like I mentioned. So when you get your Omnipod, it looks like this. This is it. So you get your little package here and it comes with a syringe and needle cap. You fill it with insulin and put it in the pod. It's going to hold up to 200 units of insulin and you can wear it for up to 3 days. It's going to communicate with different sensors like Freestyle Libre, 2 Plus, Dexcom G6, and Dexcom G7. And most of all, there is wide access through the pharmacy channel. So whether you have type 1 or type 2, we are approved for both. If you're a Medicare patient, we do have Part D coverage, which is that pharmacy benefit. So no C-peptide needed. It just goes straight to your pharmacy, and most patients on average pay about $30 a month. So let's go to the next slide. All right, and so just like I mentioned, we integrate right now with G7, G6, as well as Freestyle Libre 2 Plus, and we get asked every single day. We will be compatible with Libre 3 Plus very soon, TBD on the date. But what's really nice is there's flexibility for you. So what that means is you can get the controller that comes with the Omnipod intro kit, and you could use that. If you have an Android app that's compatible with like a Dexcom G6 and G7, you could use that. Same with the iPhone app. So for Dexcoms, you can use iPhone or Android. Libres right now, we have the controller, but this gives you the option to choose, your preference and choose what's going to fit for your life. And that's what I really want to drive home, is that at the end of the day, we want to make diabetes as easy as possible, because diabetes is not easy. We all know this. That's why this technology is so important. But truly giving you that flexibility to choose is what I love about Omnipod. And with that, I don't want to run over my time, so I'm going to share a quick little testimonial from a current Omnipod user.
The first time I remember thinking that I wanted a job in space was in kindergarten. Getting to see rockets lift off the planet, thinking about returning humans to the surface of the moon. My name is April Blackwell. I'm an aerospace engineer and spacecraft flight controller. I'm also a mom, and I have type 1 diabetes. I have a complicated career, and it takes a lot of brain power. I come home and my kids are just ready to play and they want to do fun stuff. So I love that Omnipod 5 is automated. It simplifies so much, and it's almost like someone else is looking out for you. But it also helps in small ways too. I had tubed pumps the whole time I've been on insulin pump therapy prior to Omnipod 5. Omnipod 5 gives me more freedom. I no longer have to worry about them pulling a piece of tubing, and we can just have the freedom to do more of the activities they love to do. It takes a lot of discipline and teamwork to land people on the moon. And I think it takes a lot of discipline and teamwork to manage diabetes successfully. And now Omnipod 5 is on my team.
I actually got to hear April speak at our last national sales meeting, and her story really stuck with me. So again, thank you guys so much for your time. If diabetes has felt exhausting, if injections are feeling like a lot of work for you, come see me afterward. I would love to chat with you all about the Omnipod. Thanks so much.
All right, thank you, Daniela. Next up, we have Tadej Vartanyan with Sanofi.
Perfect. Hi, good evening, everyone. And thank you, Ali and Marcella, for organizing this. My name is Tadej Vartanyan. I serve as the medical lead for type 1 diabetes for Sanofi, cover all of Southern California. Next slide, Ali. And I want to touch base on actually what Danielle just said, just real previously, right before on my end, which is whenever anyone with T1D gives insulin and the numbers go in a different direction. And all the other speakers as well that were going through all their content. The one thing that I found that's all very similar to one another, and with the CGMs, with the insulin pumps and all the devices, is that they're all filled with numbers, right? So I always see T1D as a numbers game, lots of numbers, lots of data. So today I actually want to talk about something that's probably from a numbers perspective, the least quantitative that you'll probably get, which is screening for type 1 diabetes through islet autoantibodies. And what I want to kind of touch on is looking back at my 4 years as a pediatric pharmacist, followed by 4 years as an emergency room pharmacist as well, I really got to see both sides, right? Pediatric patients and as well as adult patients getting diagnosed with T1D through a diabetic ketoacidosis or DK type of hospital admission. Happened all the time. You walk into a patient's room and you can smell that flowery smell, that floral scent from all the ketones. And, I'll never forget that, right? So when I learned about autoantibodies and kind of the impact that would have, we understood, right? You can get ahead of the T1D diagnosis, you can know ahead of time, and all the scientific piece of information. But what I actually did was I asked one of our pediatric endocrinologists, one of our medical directors, Dr. Justin Gregory, great individual. You may even hear him speak in places and places. And I said, as someone living with T1D yourself and treating dozens of patients per week on a T1D type of basis, what does islet autoantibody screening mean to you? And what Dr. Gregory said is, Todd, imagine it's completely dark in the house. You wake up and you're trying to go somewhere. Dr. Gregory has 4 kids, so invariably there are toys on the ground in some way, shape, or form. And as you're walking, if it's pitch black, even with the cell phone on your iPhone's flashlight, you're going to step on something. Now imagine there's one extra nightlight that's available in the hallway. Now imagine there are 2 nightlights, and then there's one in the bathroom. And as you begin to understand it, you realize that individuals diagnosed with T1D, some may have absolutely no nightlights, i.e. their own internal pancreatic beta cells that are producing your body's own insulin. Others may have a lot. And so even a little bit of light at nighttime makes a big impact. And likewise, even saving a little bit of your body's own way of producing insulin also goes a long way and just works really well with the insulin pump and the CGMs and so forth. So that's how I see screening for islet autoantibodies is, one, the power of knowing, 2, avoiding an unnecessary hospital admission, i.e. Diabetic ketoacidosis, and number 3, really catching T1D early. A patient who's just recently diagnosed, has a soft landing, is really able to save as much pancreatic beta cells as possible rather than, someone without T1D living through their life and then automatically just right out of the blue getting diagnosed with T1D. So that's how I like to see it. I implore individuals who have family members for them to get screened with T1D. I also implore individuals who just are curious about T1D, obviously see the impact of individuals who are living with T1D to be proactive about it and see the value of screening and knowing ahead of time. There are 4 autoantibodies, and only 2 or more of these have to be positive for one to be at risk for developing type 1 diabetes. Next slide, Ali. And there are multiple ways where one can have these autoantibodies drawn and looked at. The first is your primary care physician, or if children are involved, their primary pediatrician. When they go, and these labs can be ordered through Quest or LabCorp, any of the clinicians, and a lot of large health systems like UCLA, Providence will have these labs also done in-house. Another amazing opportunity is through TrialNet. So many of you have seen that it's sponsored by the NIDDK, which is a consortium within the National Institutes of Health that offers free at-home testing for those who have a first-degree relative, or with those who have a second-degree relative, but in the 2 to 20-year-old group, i.e. cousins, for example. Third option is autoimmunity screening for kids, ASK. Despite the word kids, this testing has been expanded to adults, and that's actually how I got my wife and my son and daughter to be screened. Free, send it to your home, do the blood work, you send it back, and it's an at-home finger prick test. And there are some opportunities that the fourth option is other companies such as Enable Biosciences may have kits available. For instance, let's say the Breakthrough T1D, they have a research grant that partner with, let's say, various institutions where they send those Enable Biosciences kit for, again, on-site finger prick testing options. Any of these options work, do what's convenient for you. I want to save enough time for others. So one thing I will warn everyone is I love to get into the science and the details. So if you come to my group, come with good questions. You've been warned.
All right, thank you so much, Tade. Next up is going to be Shelly Hall and Connor with Senseonics.
Hi guys, my name is Connor, and me and my coworker Shelly are with Senseonics, and ever since the only 1-year CGM on the market. If you could go to the next slide, that would be great. Ever since, is the only 1-year CGM on the market, and we have been out for over a year now with a year-long version. Previously, it was a 6-month and a 3-month sensor system. So if you're experiencing the following issues with CGM, such as early CGM failure, you're out with friends and your CGM dies, and I've had this happen, and then you're like, well, I don't know what I'm going to do for the next few days, but I'll figure it out. You come home and mom's not too stoked. So that's one, issue that I've seen with CGM. If you knock your CGM off when you're working out, super active, I've knocked them off, God knows how many times. So, if you're having a lot of issues where you're like, I just knocked another CGM off, Eversense is a good solution since it is a year-long product. So your sensor and your transmitter are both lasting for a full year. You're not, calling to get a replacement every, 6 weeks or whatever you may be calling in. We virtually have no false lows. So if you're, sleeping at night and you're woken up in the middle of the night by an alarm, Eversense helps prevent this due to our unique scientific that George will get into later that I honestly don't think I'm smart enough to talk about right now in a short time span. And then also, if you're having sensor adhesive irritation issues, Eversense is a silicone-based adhesive, which you get 390 of, which is a lot more gentle on people's skin. Actually, 33% of our patient population does come over for that sole reason, which really surprised me when I actually started with the company. If you go over to the man in the bike helmet, you can see that the sensor is inserted under the skin. Quick office-based procedure, no surgery involved. It's similar to Nexplanon or any other mild dermatological procedure. The transmitter is fully removable, so it's the only sensor or transmitter you can take off and put back on without wasting, a $200 device. As well, we do have on-body vibratory alerts, so if you're a heavy sleeper, you get those and you don't have to rely on your hearing. As well, you can see in the bottom what the chart looks like. You get readings every 5 minutes to your phone, GMI, everything else you would expect from a CGM system. And now we're super excited to announce that we do have a partnership with twiist, so you can get the extremely accurate year-long CGM with a pump AID system. And then, Ali, if you go to the video, that would be great.
Let's see. There we go.
Hi, I'm George, and I'm here to show you the science behind the Eversense 365 system technology. It's the first and only 1-year CGM featuring a fully implantable 1-year sensor that measures glucose levels from the interstitial fluid, a removable and rechargeable 1-year smart transmitter, and a mobile app for long-term continuous monitoring. The sensor is implanted just under the skin of the upper arm by a trained healthcare professional in a brief in-office procedure. A gentle silicone-based daily adhesive.
I'm going to go ahead and restart the video. It looks like there was a quick technical glitch. Please let me know if you can see it this time.
Hi, I'm George, and I'm here to show you the science behind the Eversense 365 system technology. It's the first and only 1-year CGM featuring a fully implantable 1-year sensor that measures glucose levels from the interstitial fluid, a removable and rechargeable 1-year smart transmitter, and a mobile app for long-term continuous monitoring. The sensor is implanted just under the skin of the upper arm by a trained healthcare professional in a brief in-office procedure. A gentle silicone-based daily adhesive patch secures the Eversense 365 smart transmitter to the skin over the sensor. This is the sensor. On the outside, you can see these 2 windows, which are made of hydrogel, the same material used in contact lenses. It makes the sensor look like water to the body and virtually invisible to the immune system. Those windows are where 2 types of indicator molecules are embedded. Glucose indicator molecules, which reversibly bind with glucose from the interstitial fluid and fluoresce, and oxidation indicator molecules, which enable real-time oxidation measurement in the hydrogel. allowing for reduced calibration, just one fingerstick calibration per week. This anti-inflammatory silicone collar here helps reduce local inflammation, while this biocompatible triple metal coating combined with proprietary sacrificial boronic acid technology allows the sensor to remain in the arm for a full year by minimizing material degradation and maintaining accuracy over time. Now, let's take a look inside. Here you can see the sensor's advanced optics, featuring 8 LEDs and 16 photodiodes. The LEDs trigger these fluorescent indicator molecules to emit light in response to glucose levels in the interstitial fluid, and the photodiodes detect those light signals very precisely. This advanced technology makes Eversense 365 exceptionally accurate over a year. The sensor digitizes the light signal and sends the data to the Eversense 365 smart transmitter every 5 minutes. The body-worn smart transmitter receives this data and calculates the glucose concentration. In the event of highs and lows, the smart transmitter gives on-body vibration alerts, threshold or predictive ones, so users can be informed without a phone nearby. The transmitter sends glucose data via Bluetooth directly to a smartphone in the Eversense 365 mobile app. Eversense 365 is designed to minimize device disruptions, delivering on the promise of CGMs. Manage diabetes, not devices. Eversense 365. 1 year, 1 CGM.
Perfect. Yeah, and then that's my favorite person ever, George. And then that is why we are also the most accurate CGM in the low range, which, as most people I'm sure know, is when you really do need a super accurate sensor, right? If your sensor's reading 65 and you're actually 150, that's a big discrepancy, or vice versa. So we'll be in the breakout room after as well, and happy to answer any questions you guys may have. Thank you so much.
All right. Thank you, Connor. Next up, we've got Ellie Clancy with Tandem Diabetes Care Incorporated.
Thank you, Allie. And I hope everyone can hear me okay. If we want to jump over into our first slide, my name is Ellie. I'm here representing Tandem Diabetes Care, and I've been living with type 1 diabetes for the last 14 years. So we want to jump over to the next one. We're going to start off with our algorithm that both of our pump options use. It's called Control-IQ technology. How this technology works is it uses values from a compatible CGM to predict glucose levels about 30 minutes ahead and automatically adjust your insulin if needed. So for example, if it's predicting that your blood sugar is going to be above 160, it will increase your insulin or give you a correction bolus if needed. Vice versa, if it's predicting you're going to be under 112.5, it'll decrease that basal insulin or shut off your insulin entirely and give you a warning that you're predicted to be under 70 about 15 minutes in the future. So it's really incredible technology to help kind of prevent those wide swings and wide fluctuations in blood sugar. And if we want to jump over to our next slide, we do have a couple of different aid systems and choices for CGMs. We have the Dexcom G6 and Dexcom G7 10-day wear that are compatible with both of our pump options, the Mobi and the t:slim. And we also have the Freestyle Libre 3 Plus that is newly compatible with the t:slim, and very soon will also be compatible with the Tandem Mobi system as well. So if we want to jump over to our next one, we've made some new adjustments with our Control-IQ algorithm. We've had it modified and studied for use in broader populations. So we've expanded indications. It is now approved for ages 2+ for type 1 diabetics and ages 18+ for type 2 diabetics. We've expanded parameters for weight and TDI, as well as added features to our Control-IQ. And speaking of features, on our next slide, we have kind of a list of these optional features that we have, including extended bolus, temporary basal rates that you can use and turn on while Control-IQ is active, meaning you are never separated or kicked out of that algorithm. It will continue to work. We have sleep activity as well, which is perfect if you want a really tight, slim control and range. We have exercise activity, which is perfect for patients. It will keep your blood sugar a little bit higher than it normally would to try and prevent those drastic lows, and then basal rates in multiple profiles as well to fit individual needs, because I don't know about you, but my day does not look the same same every single day. My weekends look different every time, so it's nice that I can build different profiles to fit different times in my week and different times in my life too. And if we want to jump over to our next slide, we are the first and only aid system with a randomized controlled clinical trial studying adults with type 2 diabetes to outperform standard insulin therapies with CGM. So on our next slide, the results of that study showed is a drastic decrease in A1C for our patients or type 2 patients using Control-IQ Plus and a 16% increase in time in range, which was a fantastic result to see. And on our next slide, we also got to see that all bolus strategies resulted in a lower A1C using Control-IQ. So what that meant, if a patient was using carb counting, preset carb amounts, fixed insulin dosing, or other methods, once they started Control-IQ Plus, all of them resulted in a lower A1C and it was dropped, which was fantastic. And on our next slide, we do have our kind of different pump options that Tandem offers. So we have the t:slim X2 insulin pump and the Tandem Mobi system. The really fantastic news is both pumps use the exact same algorithm, Control-IQ. They both have software updates, both have wireless data uploads, and have those choice of different CGMs that you can choose from, but they are different pumps. They do look and operate slightly different. So on our next slide, we have the t:slim X2 insulin pump. This one, it's about the size of a credit card in your hand. It's not too big, not too bulky. You can see my older one sitting right here. It does have a color touch screen on it. So what that means is you can control it directly on the pump itself. But it does also have an app compatibility. So you kind of get the best of both worlds here. You can control everything directly on the pump, or sometimes if you don't want to take the pump out, you can also take out that app on your phone and mobile bolus from it, which is awesome. So on our next slide, we have a kind of list of patients who might really love the t:slim X2 or might be right for them. Patients who are high insulin users and need a little bit of a higher or larger capacity or for their reservoir. The t:slim holds about 300 units, so it does have a little bit of a bigger one than our other pump. Also, those who prefer that touch screen and do not want to have a phone operating their pump, this is definitely the right one for them. Also, our Freestyle Libre CGM users and Android patients, the t:slim X2 is currently compatible with both Android and Freestyle Libre, with the Mobi very soon to come as well. But on our next slide, speaking of the Mobi, it is the world's smallest durable automated insulin delivery system, compatible with the Dexcom G6 and G7 sensors. It is currently compatible with iPhone devices. A phone is required to operate this pump, so just keep that in mind. But it does also have a button on the pump itself that can be used to mobile bolus. So what that means is it's kind of a backup. So in the event maybe you don't want to pull out your phone, maybe your phone's not with you at that moment, you still have the ability to give yourself insulin if you need to. And on our next slide, we have a couple different options for how you can wear the Mobi. You can wear it on your body with a lightweight adhesive sleeve. You can see our patient wearing it right on her arm. You can clip it discreetly onto your clothes. You can also slip it into a pocket of your clothes as well. It fits really perfectly in that teeny tiny little coin pocket of your jeans that I don't know about you guys, but I never knew what to put in there before. So now it's my Mobi pocket. But you can kind of choose which way works best for you. And then in the near future, we will also have a tubeless infusion set option for that pump as well. On our next slide, we also have some examples of patients who might love the Mobi. Those who prefer having that on-body kind of streamlined design, who want the flexibility of choosing how to wear it. If one week we want to wear it on body, but maybe the next week we want to attach it to our waistband, you can choose to do so. And then, of course, those who just want a really small, lightweight device you don't even really feel sometimes when you're walking out of the house. It's so teeny tiny. And of course, those who love an iPhone controlled system or a phone controlled system with Android phones very soon to come. But thank you guys so much for letting me talk about these devices. They are very near and dear to my heart, and I'm really excited to answer any of those questions that you have in the breakout rooms. But thank you, Allie, for letting me chat.
Of course. Thank you, Ellie. And last but not least, we have Heather Coldren with twiist.
Okay, there we go. Sorry about that. Thank you. I just want to say that there's lots and lots of great options tonight at being presented, and it's so refreshing when I think back to the first time I joined these tech nights. They were not via Zoom, but it was glucometer companies fighting over who had the best glucometer. So looking at all these options, we've come a long way, baby. I am with twiist. It is the newest kid on the block. If you want to go ahead and dive into my slides, we'll scream through them. And if you have questions, you can give me a holler or you can come into the breakout room, and I'd be happy to answer your questions. Next. This is the fine print I'm required to show. My print is the finest. Next. So some of the challenges and solutions that twiist addresses is the fact that it is available through pharmacy access. And for most patients, it's going to be $0 for month number 1 and $50 or less thereafter. It is exclusively through pharmacy. It is never through durable medical equipment. It has no contract. We don't care if you're under a contract. And again, it has no long-term contract. The technology, I could go on and on about the numbers and the bells and the whistles. Come join me if you have specific questions, but I can assure you that it's based off of the loop technology that was designed by the do-it-yourself community, and it has the broadest range no matter what feature you're looking at. That allows for unmatched personalization to meet your exact needs. Next. The core components include the Freestyle Libre 3 Plus or the Eversense sensor. That's a new addition. I need to get my slide updated. And that CGM data goes directly to the pump, which then shows up right now on an iPhone screen or the Apple Watch. It is the only pump that you can control through the Apple Watch. Next. At the most basic level, it's forecasting, adjusting, and recalculating, and trying to get the exact right amount of insulin every 5 minutes based off of a 6-hour forecast. Next. It's all about you. Again, it allows for personalized glucose targets. It has iSure technology, which is going to pick up on line blocks in as quickly as 11 minutes, but on average 19. It allows for meal adjustments and carbohydrate absorption differences. And again, it has easy access with no strings attached. Next. You can wear it just like some of the other pumps out there on the body with a sticker, a double-sided sticker. You can wear it in the pocket, or you can wear it in a belt clip. You can wear it in a bra. It's very easily accessible. And again, it fits in the palm of the hand. And I like to say it's the size of a double stuffed Oreo and the weight of a golf ball. Next. So in a nutshell, it is an all-in-one diabetes dashboard on the iPhone and also on the Apple Watch. And one of the features that makes it unique is it has a pre-meal preset that you can click on an hour before you're going to eat to help you get into tighter glucose range. Go ahead. So again, that Apple Watch feature is one of the most beloved features because you can bolus and enter your carbs, you can activate pre-meal preset, workout mode, and even take a correction bolus straight from that watch. Next. And we have the twiist Inside app that allows loved ones to follow along and see every bit of data that they want to see in order to help their loved one with their diabetes management. Next. This is the starter kit. Again, it goes directly through pharmacy. Right now, we're working with 2 specialty pharmacies via mail order, but we do have plans very shortly that it will be available in retail pharmacies that you already love and use. Next. So again, it does have a small size with a 300 unit capacity. It's got multiple discrete bolus and plan sensor options. It's the widest target glucose range, 87 to 180. And again, the accessibility through the pharmacy at the lowest possible price of $0 for month 1 and no more than $50 thereafter is really its big selling point. Next. And that's that. So there's my number, Heather H. You can write down my cell phone number. My counterpart is Marky Meyer. Many of you might love her. She's a nurse practitioner from the area. She couldn't be with us tonight, but she would love to help you as well. And our email addresses are there, or you can just come on into our chat room.
All right. Heather and everyone else, thank you so much for sharing all that knowledge with us. So we're going to break out into the next part of this meeting. So in just a few minutes, I'm going to open up the breakup rooms. All of our industry representatives should automatically go there. For all of the attendees tonight, you'll have the opportunity to manually jump from room to room. So if you see this, it should be in the bottom middle right section of your screen. It's a square that's composed of 4 smaller squares. Go ahead and click on that, and then it'll give a list of the different industries who are here tonight. Go ahead and select join to the room that you'd like to answer a question. Once you're there, quickly type your name into the chat, and then representatives, please call the names in the chat as you see them in order so that there's just a question queue and we can keep track of who's next in line to ask their question. And if you have more than one company that you'd like to speak to, you are able to come back to the main chat and then navigate to another breakout room. How you do that, in the bottom right-hand part of your screen, there's a leave button. If you click on that, it'll give you 2 options. Select leave breakout room. The other one will take you out of the meeting. That's okay if you accidentally leave. You can just rejoin and then join another breakout room. Marcella and myself will be here in the main room if you have any questions or if you need help navigating to a breakout room. And also just please be mindful that there will be probably multiple people in a breakout room at once, and you'll be able to hear each other's questions. So lots of good things coming up. And if you don't have any questions, that's all right. Thank you so much for joining us tonight. And if I don't have the opportunity to speak with you before you leave, again, I hope you have a great evening, and thank you so much for joining us.